All right. Good evening. I'm currently doing my third assessment, cluster of 7, 15-minute presentation on good hand hygiene and hand washing. With me, I have Joanne McDonald, and could you please just confirm that I have your consent to film for this purposes of education, just to the camera there?
Yep, sure do.
Okay, great. Okay, so we'll just start out. Okay, so good evening. My name's Joel Buckley. Today I'm going to be teaching you the correct procedure for hand washing and hand hygiene. I've had to use this myself in work. I've got a bit of a paramedical experience, so when working with a patient or examining anyone who may be of ill health, especially afterwards, hand washing and hand hygiene is very important. Okay, so that's a little bit about me. I know in your work as a hospitality teacher, teaching food, especially being around children, sometimes they can harbour, coughs, colds, flus, icky things as well as being in the hospitality industry within the education system. Hand washing is also very important to you as well. So with that said, we'll press on with the lesson after a little bit of housekeeping first. So just in the event of an emergency, or should we need to evacuate the classroom, through your left, through the door here on your left, we will evacuate. We'll turn left down the hallway, out the main entrance, then we will gather on the grass out the side, and then we will do a roll call if everyone's there, and we will wait for emergency services and further instructions. Just on your way out, be careful. There is a step there, and it could be a trip hazard, so just watch out for that. Also, could be a possible slip hazard on the tiles out in the hallway. So no running. Evacuate with caution and do it calmly. Okay. Mm-hmm. So in regards to washing your hands, we know a lot of general information about it. It's one of the key things for stopping the spreading of germs, coughs, colds, flus, basic stuff like that. So in that regard, would you be able to give me a couple of examples of just when you think you'd wash your hands?
Before you eat.
Yep.
After
Correct.
you've been to the bathroom.
Yep.
After you've handled food, or before you handle food,
yep.
After you've handled food,
yep.
particularly raw
Good.
foods in class.
It's basically common sense kind of stuff. A few others to know are like, after you pat animals, after you clean up blood, vomit, or any other bodily fluids, after cleaning a bathroom, or as I said before, after you examine someone who may be sick if they're in hospital, or even yourself if you've got a kid that comes into the office and he says, "Oh, miss, I'm not feeling well." You touch his forehead, see if he's got a temperature. Even that, if he's sick, wash your hands. It's just basic stuff. And now with COVID going around as well, it's it's more important than ever. And to not touch your face as well. That comes into hand washing as well. If you sneeze into your hands, if you rub your nose just out of habit, if you rub your eye, just wash your hands again, Okay, so a few tips on washing your hands. Excuse me. Use warm soapy water. It's the best option for washing your hands, especially if they're visibly dirty. You can get away with sanitizers. However, if your hands are visibly dirty, then obviously sanitizer isn't going to do the trick, because it's not going to get the grit and the grime out of your fingerprints and all that. Wet hands with warm running water. Apply your soap or liquid soap. And normal soap is just as good as antibacterial. So if you see antibacterial in something, it's not really any better than normal soap. Make sure you cover all surfaces of your hands, including the backs and in between your fingers and your thumbs as well. A lot of people neglect the thumbs, and in the webbing of your hands, a lot of people neglect too, and that can harbour some of the largest amounts of bacteria, just because people neglect to wash it when they wash their hands. A lot of people just do a quick wash front and back, and that's it. Do it for at least 20 to 30 seconds to ensure you've killed all bacteria with the soap and the warm water. When you're rinsing your hands, make sure you remove all the soap. A good way to test this is once you've washed your hands, dry them well, right? Then just wet them slightly again, and if they still feel lathery or soapy, then you haven't rinsed them correctly. Try not to use air dryers. There's been studies that have shown that they can often harbour a lot of bacteria that can be bled onto your hands. especially if the filters have not been cleaned in you don't know how long.
Okay.
So paper towel is best, although if there's none available, me personally, I will sooner just sort of let my hands air dry. I'll shake them off as best I can, and as I'm walking out of the men's room, I'll just air dry them because I don't like using those hand air dryers. Okay, so what I'm going to do now is go through a couple of tips on using like a hand rub, which is a sanitizer here. So there's not much to know with using that. It's basically just about half a teaspoon into the palm of your hands and rub them together like you would if you're washing your hands, you know, in between the webbings of the fingers, the thumb, the palm, the back, tops, bottoms. Okay. Just some general tips for hand hygiene. Carry some sanitizer with you and use it if you're about to eat. Sometimes, you know, if you're going into a food hall or a cafeteria or a food court, sometimes there's not always hand washing facilities available, and the, you know, men's or ladies' room can be, you know, a hike away. So a little bottle like this is very handy to carry, just either in your pocket, your backpack, your handbag, you know. So they're always good to have with you. If you cough or sneeze into a tissue or your elbow, you know, that's always a better option than into your hands, because then, you know, obviously you've got to go through the whole process again of washing your hands. Try and wear disposable gloves when handling, you know, anything, you know, raw meat, bodily fluids, vomit, whatever, or even cleaning a toilet. But again, still, when you remove the gloves, I will wash my hands. And here's a good one if you're using like a reusable cloth, like a tea towel in your kitchen, perhaps in your private kitchen. When you've washed your hands with it, that will be damp. So try not to leave it bundled up because it will harbour bacteria. Hang it up, you know, either over your oven rail or the bench or a tap or something, because then it can air and it can dry. Okay, so what I'm going to give to you now is this basic hand hygiene handout. And we're going to go through the steps of washing our hands. First, I'll explain them to you, and then I'll go through it myself. Then we'll go through it together, and then I will take a seat and I'll get you to do it. I'll just assess you on your ability to carry out the instructions you've been provided. So I will point out with this is a very, very, very basic handout printed out by the New South Wales government. And there is a lot more to elaborate on this in regards to the method of washing your hands. So this is just a generic sort of handout you can laminate and put up. For example, if you work in a commercial kitchen, as you do, or a hospitality kitchen, you can put it up above a sink. It's basically all pictures. It's great for kids, you know. So if you want, you'll be able to take this with you. If you choose to photocopy it, laminate it, put it up around your hospitality kitchens, you know, that would probably be good for the kids too. So there's that. Right. Now we're just going to go through the just the basic method. So what you do is soap in the fingers, in the hand. May as well just press on with the demonstration. One thing I will point out in regards to a work health and safety point of view is always double check that there's nothing in here that you may have an allergy to. Certain types of soaps, preservatives, chemicals, parabens, anything like that. And also I'll do the same with your sanitizer. So as we are going to use this, can I just get you to have a quick look, just because I don't want your hands to flare up or to feel any pain or...
No, all good.
No? Yep, all good? Okay, great. So what we'll do now is I will just run through a quick demonstration of how to wash my hands. I'll just double check this is still recording. Yep. How to wash our hands. So we've got 2 tubs here. As I said, warm water is best, which we have. So we're going to wet our hands just lightly. Bring this over here, ready? A pump of soap. So like I said, about half a teaspoon. Start lathering it up in your palm, as such. Once your palms are a bit done, I like to go in between my fingers all the way down. And my fingers like that. Then I turn my hand over, do the back side of the fingers, like this, as such. So that way you're getting in the webbing, both sides of your fingers, right? From there, I go to the tops of the hand, right? Both hands, then the bottom, okay? Now this you should be doing for about 30 seconds. So in the time it's going to take me to explain this, it should be longer than 30. So tops and bottoms, right? And then as I said, the webbing of the hands and the thumb is a big part that people forget. So webbing of the hands and the thumb on both sides. Then what we're going to do is another point people often forget, and I don't see many people doing this, and this is a good tip. Is just in the palm of your hand, get some soap together and do the tops of your fingers, because germs and that can hide in the tops of your fingernails there. And do both hands. So left, little circles, left and right, like that. And then finally, we're just going to go around the wrist, because a lot of germs can hide at the base of the hand around the wrist. Once that's done, you'll give our hands a rinse once in that tub. Then we'll come over into the second tub here. Obviously you'd be doing this under a tap in the workplace, but this is just, this classroom, we don't have one. So just for the purposes of demonstration like that. Even when you're rinsing, get into the palm, get into the webbings of your fingers again under a tap, right? Rinse the webbings of your fingers, your thumb, and around your wrist as well, right? Because you don't want any soap. If you leave soap on your skin, it can dry it out and it can crack it, and it can just leave it feeling uncomfortable if you do it too often. So again, we'll dry our hands off well, cut the squares of paper towel just to preserve a bit of paper. And again, you want to dry as many surfaces of the palm of your hand as you can. So the webbings, right? Now, as I said before, once you finish drying your hands, you should be able to sort of rub your hands together, and they shouldn't feel soapy or lathered up at all. If they do, rinse them again and dry them again, because you don't want to leave soap on your hands. Okay?
Yep.
Now, you comfortable with that? Okay, great. Stand up here, we'll run through it together. Okay, so wet our hands. Yep, about half a teaspoon of soap. That's it. Now, palms, right? Inside the fingers, right? Both hands. Backs of the hands. Yep, that's it. Make sure you get both hands. Right, now, tops of the hands, so you want to go just using your right hand, top of one hand, then the bottom, then the top of the other, and then the bottom. And then I go straight into the thumb and the webbing of the hand. As I said, that harbours a lot of germs, right? And then you want to get your nails, like just make a little sort of flat fist like that, so your thumbnail gets it as well. And just rub it in the soap in the palm of your hand. You can cut the palm of your hand if it helps. And then same as the other side, yep. And then just around the wrist of both hands, yep. Perfect. And like I said, 30 seconds. That was about 30 seconds, which is really good. So rinse into the first tub. Yep. Now into the clean water in the second. And again, just to repeat myself again, this would obviously be done under a tap unless you're in the middle of a field camping and there's no other alternative. You do the best with what you've got. Yep. Perfect. Make sure they're rinsed out really well. A couple of squares of paper towel. And again, you're going to want to rinse all the surfaces of your, dry all the surfaces of your hands. Great. Right, now as I said before, just rub your hands together and see if you can feel any soap or anything on them, or they feel...
No, they look good. They all feel clean.
Good, well done. Yeah, really good. Okay, so now I'll take a seat over here, excuse me. Now just jump in there, and for me, just go through the procedure of doing a complete hand wash for 30 seconds.
Okay.
So you just approach the sink. Yep.
So wet hands.
Yep.
Just a small amount of soap.
Yep. About half a teaspoon.
Yep.
Yep. Palms. Yep. Fingers.
Tops.
Yep.
Bottom.
Yep.
Top. Bottom.
Yep.
And then thumb. Just in there. Around the wrist.
Yep.
Done.
You missed two bits.
What did I miss?
So you missed the backs of the webbings of your fingers.
Yeah.
Yep. And
That's
then
it.
your nails.
Oh, of course, my nails.
That's it.
Yeah.
Other than that, perfect.
Okay, nails.
Did good. That's actually a pretty important area that people forget, because think of the build-up your nails can get.
Especially long nails.
Yeah, exactly. You know, if you got acrylics or anything. Yeah, perfect. That was good.
Okay.
Aside from those two little tips, you picked it up well. There you go.
Thank you.
Well done. That was very good. You did really well. Just dry the surface down a little bit. Right, now the next part that we're going to go into is just sanitising of the hands, which you would do usually immediately after washing your hands, or if you didn't have any soap and water, you would use as a substitute. However, it's not ideal, but if you have nothing else, use it. Especially if the hands are visibly dirty, it's really not going to cut it, because if they're visibly dirty, it's not going to get rid of everything out of the, you know, the grit in the hands. So we'll just go through the process of doing that to finish up.
Mm-hmm.
Now, before I go on to this, do you have any questions? Anything you don't understand? Is it all clear? All good?
Yep.
Yep. Okay, good. So again, sanitizer into the palm of the hand, about half a teaspoon. Right, you really don't need much because this stuff goes a long way. And again, just palms of the hands, webbing, front, back, the fingers, right, the thumb. Yeah, this stuff won't feel like it's spreading like soap, but it is spreading. Right, the wrists, and then do your nails.
Okay.
But be careful if you've got little cuts or cuticles on your hand, because it can sting a little, but it's killing a lot of germs, so it's good. Okay, and that's really all there is to that. The sanitizing is very easy.
Mm-hmm.
Okay, so just come up here and we'll get you to do it. Now, because this dries your hands out, I'll just get you to do it just the once. We won't do it twice together, okay? So half a teaspoon, you go for it. Yep, hands together, the webbing, front, back, yep, tops, bottoms. Perfect. Then your wrists, yep. And then just rub your nails on the last of it in the palm of your hand. Yeah, brilliant. Yeah, too easy. So with this basic knowledge, and it is basic hygiene knowledge, however, you would be surprised how many people neglect to do it. And especially kids, they'll just come running in, you know, no thought to hygiene or anything, because it's just something they don't think of. So now you, with this information, you have the tools and the knowledge to be able to get these kids to prepare, you know, food or whatever it is they're doing with, you know, correctly cleaned hands. And if you're lucky, you can tell them to take it home and show their parents too. They might even be impressed too. So, yeah, all right, before we finish up, do you have any more questions or anything?
No.
Okay.
That's great.
Great, well that hand hygiene poster is for you.
Thank you.
And you can take that as well, throw that in your purse or your bag or anything. And yeah, that about wraps it up. You will receive just a feedback email on this brief as well. If you could please fill that out and send it back. We do that with all our students too. So that would be greatly appreciated. Okay.
Okay.
Right, Joanne, thank you very much for your time.
Thank you.